very much, Mr. Moderator. The Special Representative of the UN Secretary General, the Director General of the World Health Organization, the Assistant Administrator for Global Health, USAID, colleague ministers from the Manu River Union, Excellencies, distinguished guests, ladies and gentlemen, members of the Fourth Estate. I bring you all very warm greetings from His Excellency, the President, Dr. Ernest Bai Koroma, his government, and the people of Sierra Leone. It is my pleasure and honor to be here today and to be able to make this short statement. What the Ebola outbreak has taught us all is that in the absence of a strong and resilient health system anywhere in the world, what may begin initially as a small, localized health problem in a tiny area of the globe can quickly spread and become a threat to global health security. This is what the Ebola outbreak has taught us. Permit me, Excellencies, to just mention a few peculiarities of the West African Ebola virus disease, because these peculiarities will have a bearing to my next statement. The current outbreak of Ebola virus disease is the first in the West African sub-region. And then it is also the first to affect more than 3 countries almost simultaneously. And it is the first in terms of the speed of spread from rural communities to the densely populated urban cities of Monrovia, Conakry, and Freetown. And it is the first in terms of the scale of human tragedy. And this is the first time in recent memory that a state of public health emergency has been pronounced by the world governing public health body, the World Health Organization. And at the time of the outbreak, the international health regulations were either not implemented at all in any of the 3 most affected countries, or if they are, then those implementation steps are at a very, very rudimentary stage. So it is not difficult for all of us to see that prior to the outbreak, there is no signal, no information that was specific enough to anybody, either the countries that are affected or the wider international community, to have acted as a warning sign of a pending epidemic of this nature. So any criticism of either the affected countries or the world community should be made bearing in mind the complex nature of the epidemic that we face. So instead of spending time on the blame game and conspiracy theories, I believe we must all celebrate the manner in which the world at large has come in support of the affected countries. And on this note, on behalf of my colleague ministers from the MRU, I want to publicly acknowledge the support and the leadership role of the World Health Organization. To Your Excellency, Dr. Chan, we want to say a very big thank you, and also through you, we want to extend our appreciation to your organization for living up to its mandate. We thank the Department for International Development, and the British people for their leadership role they also took in this crisis. USAID and American people, JICA and Japanese people, China, Australia, Cuba, to name but a few, and of course, the World Bank. We want to thank you very much for your support. While we mourn over the loss of lives of thousands of our compatriots, let us also don't lose sight of the opportunities that the West African Ebola virus outbreak presented to us. This outbreak has injected a new sense that the world is indeed a global village. It has injected to us all a sense that we are each other's keeper. A sense that we all have a responsibility to one another for our own survival. This is evident in the manner in which the entire world responded to the sufferings of just 3 countries. So as we complete the task of getting rid of the Ebola, getting to zero, staying at zero, and beginning the long journey of building a resilient health system, we hope this renewed sense of solidarity that the Ebola virus outbreak disease has brought will continue to translate into true partnership and continued support in the coming years. We pledge for our part our commitments to the Paris Declaration, the Accra Accord, as well as other international partnership pacts that we have signed up to ensure that your support is not wasted and your aid becomes more effective. We pledge to use the lessons that we have learned from this epidemic to guide our ways of doing things, so that never again will the world have to witness such a tragedy. I thank you all for listening. Long live global solidarity. Thank you.